Okay, good afternoon, everybody. Okay, guys, over there in the corner, let's, no talking girls in your corner. No, Daisy, you're good? Okay. We now have a quorum with everybody that has checked in online. We have our 11. So we're going to get started on our committee meeting for the day. And I'm going to go ahead and call Representative LaHood for House Bill 245. Huh?
Thank you, Madam Chairman.
Wait a minute, is it on?
Come on.
Yeah, we got it.
All right. Well, thank you. And House Bill 245 is what I'm here to present today. And it really is a simple bill. And it's the purpose is to change one word, basically. There was a bill that passed last year. Representative Houston Gaines sponsored it. And it was a good bill that allowed doctors of podiatric medicine, podiatrists, to organize and jointly own a professional corporation with MDs and DOs. And so in that was accomplished. That was the good thing. There was a Scrivener's error where the word renewal of a license for podiatrists was used instead of reinstatement. And so the consequence of that is, if we don't fix this in this bill today, or this session, by June, the 500 or so podiatrists in the state of Georgia will all have to go get fingerprint background checked, which they've already done when they got their initial license. It's not customary and it's unnecessary for them to have to be fingerprinted every 2 years when they renew their license. They should only have to get their fingerprints done if they lose their license and want to get it back, reinstated. And that's the word we put in this bill, reinstate. We replace reinstate with renew. Any questions? Yeah.
Okay. Are there questions for the representative? Oh, come on, guys. Now, anytime somebody gets up, and especially somebody that has been here a while and says it's a simple bill, don't you know better than that? Representative, we really ought to come up with some hard times to get in. The one thing, there are not any of the professions that require a repeat on the
fingerprint
every 2 years, right?
Correct.
Okay. It's just when they first
right.
Like the medical association, they had to go back to all the doctors that had already been in practice, but then now it's only upon application of it.
Right. If the law stands like it is, the podiatrists will be the only discipline among their other peer disciplines that have to do this. Right. And again, it was just an oversight. It wasn't caught last year. Very simple fix, and we just want to make sure
I'm just giving you a hard time.
Oh, I know. We just want to make sure we fix this so that.
Please don't say it's a simple bill on the floor.
We just want to make sure the great citizens of this great state can get their toenails cut when they need to, and don't miss their podiatry appointment because the podiatrist didn't renew his license.
Good idea. Okay, and we don't see any questions. There's no questions. No. Oh, all right. All right. We had no questions from anybody on the. Okay. All right. This would be the appropriate time.
Madam Chair, I'd like to move that we get a due pass to House Bill 245, LC 338547.
Okay, we have a due pass. Do I hear a second? Second. We have lots of seconds. Is there any further discussion? Is there anyone that wants to speak to the bill? Nope. All right. At this time, I'm just going to let everybody vote at once. Okay. Everybody, let's go. Everybody in favor, say aye. Aye. Anyone opposed, no. All right. We have the ayes have it.
Thank you.
You're welcome. Senator Kirkpatrick. That would be Senate Bill 5. Welcome to the House, Senator Kirkpatrick. I think not too many of you have been over here yet, so. Is that on?
Senate Bill 5, which I think we're working from LC 338638S.
That's right.
Okay. This is a patient safety bill, and it relates to sedation in the outpatient setting outside of a hospital or ASC. This conversation started after 2 deaths in my county in young adults, which occurred in a Medi-Spa. The facility did not have appropriate personnel or equipment to do procedures requiring sedation. The details of the cases are horrific, and of course, both resulted in lawsuits. In addition, there was a case in my county last fall of 3 unlicensed people doing cosmetic surgery in a Medi-Spa with more than 30 patients testifying at the trial. On investigating how this happened, I learned that Medi-Spas are not clearly defined because they're licensed under a business license and not as a healthcare facility. In other words, they're licensed the same as a nail salon, a tanning salon, or a sauna. Therefore, they're not regulated by DCH's healthcare facility regulation unit. Procedures like Botox or minor procedures under local anesthesia are done in Medi-Spas, that sometimes larger procedures like liposuction in this case are done. Doctors and dentists do perform sedation in the office setting at times, and there are guidelines in place by the Composite State Medical Board and the Board of Dentistry that outline proper procedures. However, because this is not addressed in the code, bad outcomes often do not become known to the licensing boards until after the fact, which can be too late for patients. Certainly, most doctors and dentists are practicing safely in this situation, and the licensing boards have done a good job in laying out expectations, but they don't have the force of law behind them. After months of discussion with both boards and the Secretary of State's office, the approach of this bill is to simply state that if you're doing sedation, anything other than local anesthesia outside of a hospital or ASC, you have to follow the rules of the licensing boards, which include appropriate personnel, equipment, and monitoring. Since the Composite State Medical Board has guidelines rather than rules, they'll have to promulgate rules on this by the end of the year. The dental board has a permitting process in place to protect patients, and they also support this bill. This does not change anyone's current scope of practice. Section 1 talks about dentistry and defines Medi-Spas. Section 2 amends the Medical Practice Act and requires the medical board to promulgate rules and regulations for physicians covering a number of issues. Office-based surgery and sedation are defined. This bill should protect patient safety without adding a regulatory burden to the practitioners who are taking care of Georgia's patients. I'd be happy to answer any questions.
Questions for the senator? Okay. All right, Representative LaHood.
Am I on? All right, thank you. Could you, I appreciate the presentation, and you probably said it, but could you just kind of simplify to us what a person might, an average citizen that might use the services at a Medi-Spa could go in and not know that they're getting into, or not know what risk they're taking?
Well, the problem with this type of thing is that patients are kind of at the mercy of the consumer review sites, which are really the Wild West. And so somebody gets a 5-star rating. The first patient I was talking about in one of the lawsuits was a word of mouth referral from a friend. And so the care is not really vetted in any particular way. It's just basically the internet, or they're at the mercy of someone who gives them a referral.
Senator Kirkpatrick, I think he's asking you, like, what specific service would they get where they would need to be sedated? I mean, do they sedate them for liposuction, or what other kind of things would they perhaps be sedated for? Is that it, John?
So we're not really talking about taking off lumps and bumps or skin tags or complicated procedures like liposuction that most people would think of as being done under twilight anesthesia, which is what you would commonly call conscious sedation. Those procedures can rapidly get into trouble based on airway and other problems. So major cosmetic procedures are probably the biggest thing I'm worried about with this bill.
And do you know how many of these there are in the state? How many?
There's no way to find them because they're licensed under the same classification with about a dozen different things, tattoo parlors and so on. And so that was the problem. I was originally going to address the bill just to med spas, but because they're in a very broad classification, it wasn't possible to sort that out.
I mean, let me see. This would be like when you have a colonoscopy in the where they would give a very brief sedation where normally a person, I think the half-life on it is what, like three and a half. I mean, it's like minute, the half-life, but what they normally have available are all of the equipment, like a crash cart in case they went into respiratory arrest or there was problem with the airways, right? And that these spas didn't have oxygen or any.
Right. There needs to be licensed personnel to push the drugs. There needs to be monitoring in place. And there are very specific things that are outlined in the anesthesia literature. And when I worked at a hospital, I had to take a test and check off all the boxes that I knew how to do conscious sedation. And none of that is taking place in some of these facilities. So I didn't want to detail all the specific things that had to be in place, like you have to have this machine or that much oxygen or whatever, because those guidelines can change. And that's why the medical board and the dental board need to be in charge of the specifics that are required. And we just want the practitioners that are doing this type of procedure to follow their rules.
Okay, Representative Sharper.
Thank you for bringing it, Senator. Thank you, Chair. One thing I think we need to look at doesn't maybe need to be included in this bill, but you said there were different cases that were in your community where something happened. I think somebody still needs to take a look and eventually find out what drugs, okay, that they're talking about that's doing the sedation. And that way you can kind of see this is good, but it still leaves room for certain things so that if certain drugs are being used and it's becoming a habit, then you can kind of put your finger on a little bit more to say, look, if you're using these particular drugs, the accountability is a little bit higher for you. And we can kind of, look at that a little bit more. So I would just be interested in knowing which drugs that they're having the more problems with. Then that way, if these different clinics are using these particular drugs, they definitely would have to follow this because, the sedation can, go like that, go downhill quickly. I mean, I've seen it happen before, but I'm just saying, just the drugs would be very interesting to know.
Yeah, I can tell you offline the drugs that are in play in these particular instances, but the technology changes, the science changes. And so that's why I was hesitant to put specific drugs or specific requirements for monitoring in this particular bill. And of course, we're always trying to make things better down here. So it may be that as things evolve, we'll need to change that going forward.
All right, thank you.
But Senator, they are using basically the same drugs that you would use in a surgery center or a hospital, right? For this light sedation.
Well, Madam Chair, I would hesitate to call it light sedation
Okay.
because there are different levels of sedation that are outlined in the anesthesia literature, and maybe somebody from the anesthesia community would like to speak to that. But as I said, there are certain drugs that are commonly used today for this type of surgery. Next year, we may be using different drugs.
Okay. I guess what I was getting at, I don't know that it's so much that the drugs are the problems, but the people that are handling the drugs and their lack of knowledge what to do if a person gets in trouble, and that everybody that has any kind of surgical procedure, we never know exactly what's going to happen and how they're going to respond. That's why, they always say, you need to be a little bit nervous going into surgery because you never know what might happen.
Well, that's exactly right. And the circumstances can change quickly, and the process for monitoring is extremely important. The type of personnel that are involved is extremely important, and the response when there's an emergency situation that happens is certainly critical. And in these cases I'm talking about, none of that was done. So just trying to get started on getting some kind of control over this
like
process.
that, and we can come back and look forward. Tony, did you have something you want to say? So she's called on the anesthesia people to come up and say things. So tell us who you are besides Jet.
Good afternoon, Madam Chair and members of the committee. Jet Tony. I serve as Executive Secretary of the Georgia Society of Anesthesiologists. The GSA thanks Dr. Kirkpatrick for bringing this important patient safety legislation, and appreciates the opportunity to have worked with her and the Composite Board of Medical Examiners on behalf of anesthesia patients throughout the state. This policy, this bill, is 20 years in the making. And I'm going to give you the little story here. History of legislative attention on the regulation of office-based procedures began in 2001 when then State Representative Larry Walker introduced a bipartisan bill, House Bill 784, which would have required comprehensive regulation of physicians who provide certain services in office-based surgical settings. The bill passed the House. It did not pass the Senate. Now, my recollection is that the members of the medical board at that time did not feel like that the medical board had the statutory authority to promulgate rules and regulations for anesthesia and procedures in office-based settings without legislative action. So during the period 2001 to 2009, a number of terribly unfortunate incidences occurred in office-based settings and dental offices. So this raised public concern. The media certainly put a glare on those terrible incidences, and the GSA began working with the medical board, the Medical Association of Georgia, and other medical specialty organizations to craft guidelines for anesthesia and office-based surgery. So working together, those parties created the OBS guidelines that were modeled by the best practices in all 50 states and the American Society of Anesthesiologists standard, the gold standard for office-based anesthesia. So the medical board adopted those guidelines in 2010. And while the guidelines do not have the force of law or rule, the guidance has proven to be a solid template for medical treatment, especially as it relates to sedation of patients outside of hospitals and ASCs. But as Dr. Kirkpatrick said, there's been a proliferation of aesthetic dental offices and surgical procedures outside of the already heavily regulated ambulatory surgical centers and hospitals. Dr. Kirkpatrick's bill accomplishes protecting patients by codifying the scope and responsibility of qualified anesthesia providers in office settings. And it sets and this is, I think, the real nut of it. This is the brickbat. It sets a clear line of responsibility for the outcomes within those offices. Senate Bill 5 will not only give the medical board and the dental board the authority to regulate what occurs in med spas and dental offices, but it will also require it of those two regulatory boards. Future patients will have that comfort, but more importantly, they will have that protection. As it was in 2001, in 2010, and as it is today, the GSA embraces these foundational principles of medical care. All patients should receive the same level of anesthetic care regardless of the setting. And patients deserve the assurance that a single safety standard applies regardless of operating procedure location, the time of day, or whether it's a weekend or holiday. Senate Bill 5 is protective of human health and will not only protect against unintended outcomes, but will also give medical and dental consumers confidence that they are being given appropriate standards of care. So on behalf of the more than 1,300 members of the GSA, that includes physician anesthesiologists, resident physicians, and anesthesiologist assistants, and AA students, I urge your favorable support of this bill. GSA also supports the amendment that Mr. Jeremy Betts will present. The amendment assures that each of the 3 anesthesia providers licensed by the state of Georgia are included in the portion of the bill dealing with dental offices.
Okay. We made a substitute instead of an amendment, but Jeremy can explain that. Why do you think it's taken so long? Was it because in the last few years, the procedures in medi spas have really just exploded across our state?
That
And-
would be my gut answer, that while the incidences that occurred during the first decade of this century were truly horrendous, and there have been others since, and certainly Dr. Kirkpatrick knows of these. The sheer number of unregulated facilities is frightening now. And as we say in our statement, the same standard should exist regardless of where the anesthesia is being administered. And I will say to the answer, part of the answer to a previous question is, along with assuring that licensed anesthesia providers are involved in the anesthesia, what you get with that is a licensed anesthesia provider is very unlikely to work in a setting like this unless there is monitoring equipment and resuscitation equipment. And frankly, the reason, and I know that those who work in the medical field and EMS know that if you don't have resuscitation
Right.
equipment, your backdrop is 911, and it's often too late if the patient gets in trouble.
Thank you. Jeremy Betts, do you want to come forward? And the amendment has been included in the substitute, but if you would explain the amendment.
Certainly, ma'am. Within the draft, I have yet to be able to see the substitute, but
Oh,
within the,
sorry.
no, that's fine, ma'am. Within the original draft, physician anesthesiologists were carved out to not be practicing the unlawful practice of dentistry when supplying anesthesia in these practices.
It's on line 95.
Yes, ma'am.
Need my,
Um,
can you get? Line 95. So for the members, it's on line 90, starting on 95.
And it's subsection 3. All this does is clarifies and adds physician assistants who have completed a board-approved anesthesiologist assistant program to the 3 types of anesthesia providers that are allowed to provide anesthesia within these practices. And so it's meant to just include anesthesiologist assistants, but in Georgia, they're licensed as physician assistants in anesthesia. That's merely the intent of the amendment, and doesn't go any further.
Okay. Are there questions for either Jet Tony or Jeremy Betts? No questions? Okay, thank you.
Thank you, Madam Chair.
Are you lurking? Want comments from the Dental
Well,
Association?
Since it does implicate us, Madam Chair. I would
Go
like to
ahead.
Just, thank you for recognizing me, Madam Chair. I'm Scott LaFranco. I'm the General Counsel and Vice President of Government Affairs for the Georgia Dental Association. We represent over 3,500 licensed dentists and specialists in the state of Georgia. We support Dr. Kirkpatrick's bill. Obviously, if there's going to be general anesthesia, deep sedation, and I think to answer one of the earlier questions, this is the highest level of sedation. This is when I believe you're going to be intubating a patient. They won't be able to maintain their airway on their own. So the way our Board of Dentistry sets up the sedation rules is you have different levels of sedation. And her statute, her proposed bill would affect just that deepest sedation technique, which is, of course, the most dangerous outside of a hospital setting. So we do support that. The issue of this amendment is news to me. This seems to be adding a new position within the Dental Practice Act to administer anesthesia that we weren't aware of. So, my interpretation of the current statute is only CRNAs and anesthesiologists. So this is a new change to me. But
Jeremy, would you like to clarify that? That's not my understanding. I mean,
Yes, ma'am. To my understanding, this would not actually be general anesthesia that is practiced within a traditional hospital or a ambulatory surgical center. This is merely for conscious sedation.
Okay.
I'm correct in that? Yes, ma'am. So that is a different standard than what was previously described. And anesthesiologist assistants are licensed to provide general anesthesia in any of the Title 31 licensed facilities.
I tell you what I'm going to do. Could I get Dr. Kirkpatrick? We're going to just hold for, this bill for a minute. Can I get you, Scott, Jet, and Dr. Kirkpatrick to step outside the room and work on this? Please, Kay. Thank you. Okay. Yeah, Katie, Representative Dempsey. And this is House Resolution 52. We usually don't take study committees for the summer until after crossover day because they only have to be approved by the House. But this one is a joint study committee between the Senate and the House, and it requires that it move exactly like a regular bill. So that's why we're taking it up now. Representative Dempsey.
And thank you, Madam Chairman, for that. This exact measure passed last year on March 5th of 2020, I think unanimously from the committee. It moved forward into rules, and then quickly we ended the next week for a much longer time than we planned to, but it was quite obvious that there was not going to be space for study committees, even for gathering in any way. So we're looking at the exact same measure. It is a resolution coming from the Department of Public Health. This is very important. At this time when we are dealing with COVID, there are also other things that are happening, and that it's really, really important that we not ignore those. This is dealing with lead exposure, particularly in our children and in pre-birth situations. Under age 6 is the child that would be at the most risk. And, it's really something that cannot be reversed. It can be brought on, can cause miscarriage, premature birth, with irreversible damage to the brain, kidneys, and nervous system. You all have a wonderful handout there from Voices for Georgia's Children that breaks it down very succinctly about the true need for this. Lead poisoning is 100% preventable. 100%. It doesn't have to happen. Georgia childhood lead exposure law has not kept pace with the current science and research of lead health effects. So the CDC recommends very specifically that public health action be taken for a very clear amount of lead found in the blood levels of children. DPH, though, is prevented from taking any regulatory action in which a child is exposed from lead paint in the home unless the child's blood level is much higher. And that level would be 3 to 4 times the increase from the current CDC public level that it should be. Lead addiction and lead additive in residential paint was outlawed in 1978 and was fully phased out with consumer gasoline in 1996. I will tell you that I lived in a house until recently that was about 100 and almost 20 years old now, maybe 122 years to be exact. The paint stayed on the walls forever. We painted it one time and didn't paint it for 35 more years. One of those reasons was because of that lead. It was a strong way that people really like to use because it kept you from repeating that. But at the time, I was very aware of it. And we were fortunate there was no flaking. I look back on it with my own children and think, oh, I'm glad we didn't have a problem with this. But it was very common. It still is very commonplace in many of the Georgia residential areas that exist today in our historic homes. Blood lead in Georgia DPH reportable diseases with all blood lead tests are reported to the environmental health section. They're very active in their work. They are doing a good job. But as I said, We are not in compliance with the knowledge and standards that exist today. This would allow us to take a true look at this, make sure that this challenge, which impacts 1 in 5 children, most likely with attention deficit hyperactivity disorder. It impacts IQ reduction, learning disabilities, speech and behavioral issues across the board. We need to study it. It's one of those things that does not need to be lost in the net of COVID right now. It comes to you with support, not only from Voices for Georgia's Children and the Department of Public Health, but Georgia's Children's Healthcare of Atlanta and the Georgia chapter of the American Academy of Pediatrics. It is a request to try to consider a study committee that would be from both chambers. That is our goal. That's what it was last year. Like to try that. If for some reason it does not make it out for crossover, if y'all vote in favor of it today, then we'll come back and reevaluate and see if the House can also continue to look at it, because it matters, and it matters today.
Okay, questions for Representative Dempsey? I just want to say thank you. I can't remember the year, but I brought a bill to get lead out of apartments, which we passed, and I just don't see anybody representing the apartments here. Are you representing the apartments?
Yes, ma'am.
Yes, okay, they're here. We went through that and a few years ago, and obviously it didn't go far enough at the time. But
Well, yeah.
it's what we could get through at the time, and it did help some at that point.
Mhm.
And some of the apartments and the rental across our state, rental planes. So
Well, and
thank
it's
you very
not
much.
just apartments. Let's make sure. I mean, like I'm saying, I lived in an older historic home that I know
Right.
the lead was there. So it is. It's an age specific sort of painting as well as other things in homes.
I mean, we were able to go with the apartments last time, not private homes.
Right.
It was the area that,
Yeah. And this is not
Yes.
to attack the homes. This is actually just to find out the levels and find out, let's study it. Let's look at it.
well, and it's just that people don't know. And it's something that you wouldn't think would be around anymore. Just like you said, you lived in the home with your children growing up. Luckily, they didn't chew on the windowsills or
Absolutely.
have flaking paint that they pick up everything on the floor when they're
Mhm.
toddlers. So it's not just being critical. It's just we've learned a whole lot more
Yeah.
as time goes on. Representative Bennett.
At the appropriate time, Madam Chair. Oh,
Okay, we are at the appropriate time. I will let you. Right now, we would have Elizabeth Apley that would like to speak.
Okay.
Here you are.
Madam Chair, thank you very much. And thank you very much to Chairman Dempsey for bringing this bill, for the Department of Public Health for leading, and Voices for Georgia's Children. On behalf of Presbyterians for Better Georgia, Enterprise Community Partners in Georgia, Advancing Communities Together, we just wanted to express our support. Just to add a bit more of history to this, in 2000, the U.S. Department of Health and Human Services made a goal to eliminate childhood lead poisoning in this country by 2010. And we're now in 2021, and we haven't accomplished that goal. We know that 118,000 Georgia children under the age of 6 were screened in 2019, with over 2,300 found to have lead poisoning in their system. We believe that there are many other children, perhaps hundreds of thousands under the age of 6, who are not being screened. And so this number could be even more severe. And we know that lead exposure can be irreversible in its consequences. We know that 30% of the housing in this state was constructed prior to 1978. And while some of it is properly maintained and properly cognizant of lead abatement proper procedures when renovations are done, many are not. And so we thank Chairman Dempsey and this committee for their attention to this very important children's health issue.
Thank you.
I'm happy to answer any questions.
See anyone else that wants to speak on the bill? Okay, all right. Any other questions from the committee? All right, Representative Schofield, you are recognized at this time. Oh, Bennett, sorry.
thank you so much. Thank you, Chairman Dempsey for bringing this. I do know that in times like these, the lead situation needs to be revisited because I think there are a lot of silent cases that go unrecognized. So I move to pass, Madam Chair.
Right, all right, have a move to pass. Do I have a second? Okay, I have a second. Is there any further discussion from the committee? Questions? No, so we'll vote at this time. Everyone in favor of the passage of House Resolution 52, say aye. Anyone opposed? No. Okay, bill passes. Thank you very much. Okay, that takes us to House Bill 307, which is my bill. This is a telehealth act. And basically it started out with me because of the mental health problems that we are seeing across our state thanks to COVID. Depression is up, anxiety, substance abuse. Young people are committing suicide, are considering suicide. Child pornography is rampant on the internet, and child abuse. So there has been such an increase in the need for psychiatric care. And, this bill will ensure access for our most vulnerable citizens to mental and behavioral health services. And we just cannot allow the lack of broadband or technology or transportation to keep these very vulnerable citizens from getting the help they need and leaving them out in the cold. This is a limited extension of coverage for mental and behavioral health care delivered by phone and under special circumstances. And it allows providers to render from their homes and for Georgians to receive care when they're in their homes. It also ensures that mental health professionals are only a phone call away for many of our citizens who cannot access mental health services through other means. And to explain the bill more fully, technology is certainly not my forte. I would like to ask Bethany Scherer to come forward and go over the general aspects of the bill, because it does cover, telemedicine is being covered now because of COVID, pretty much wide open. Is that correct?
That is correct.
Correct.
So
Bethany is with MAG. She can introduce herself, but now it's wide open under the governor's emergency orders. However, if they ended any time without a bill like this, then we would not, and our citizens, many of them who've used telehealth very successfully, would not have the same kind of access. So that's why we're bringing this bill at this time. Okay, Bethany.
So like Chairman Cooper said, my name is Bethany Scherer. I'm with the Medical Association of Georgia. We want to thank Chairman Cooper for bringing this important legislation. Most of you should remember a few years ago, there was a bill addressing telehealth parity in part in Georgia, and that was Senate Bill 118, I believe. There are some gaps in that. And during COVID, we obviously had some situations where telemedicine was not available to certain populations, especially. There were lots of restrictions on telemedicine in Medicaid populations and among some private insurers. A lot of the different orders that came out of both the Department of Community Health and out of the governor's office addressed a lot of those concerns, but they are only temporary and they only last us through COVID. And I think that what we've seen and what our physicians across the state have seen is that patients really appreciate the way telemedicine works and the way telehealth works for them and fits into their lives in a little bit better of a way. And it is certainly a very important tool that can be used for those who suffer from mental and behavioral health issues. And it can also help address just a multitude of problems that some of the populations that were not able to access telemedicine before have in terms of access to care, like transportation or scheduling appointments or inflexible work schedules that just don't allow for them to get to a provider in time during their hours that are typically available. This bill does a few things. I think Chairman Cooper did a good job of explaining a lot of this. Some of the things that it does cover are like utilization review, which is prior authorization in sort of other words, and it makes it so that there's some parity there. So we have seen insurers require different types of utilization review for telehealth services where they don't require those for in-person services, or they require an in-person visit before you can ever use telemedicine. And I will say technology has come a very long way. So we have changed from a time when it may not have been possible to establish a physician-patient relationship via telehealth or telemedicine. And now we're able to do that, especially in the behavioral health and mental health space. And so this bill sort of addresses those issues. And then addressing audio only, and that can be a little more difficult. And for the most part, I will say the Composite Medical Board is who sets sort of the guidelines for physicians, and then all of our different boards would set it for their providers that are licensed under them for how you can form that patient relationship enough to establish a standard of care. Right now, the Composite Medical Board essentially says that the standard of care is the same. So if you see someone virtually, the standard of care is exactly the same for if you see them in person. So as long as you can establish that relationship in a way that is equivalent, then you can do it. But we do have some federal laws that sort of hinder us when it comes to prescribing. We're hopeful that that will change. It's been about 1.5 years since they were supposed to start changing, but we haven't actually seen new rules around that. And that's called the Ryan Haight Act. So we're hopeful that that will change. And just sort of making sure that physicians don't have to have a different vendor, or other practitioners don't have to have a different vendor depending on which insurer they're having to use. So let's say you're going through, if I have to have one vendor to provide care to United Healthcare patients and one vendor to provide care to Blue Cross Blue Shield patient, and so on and so on. That can become really expensive for the practice, and it can also just be a really big hurdle to providing that care. And so making sure that they don't have to do that is really important. I'm happy to take any questions.
For Bethany or for me from committee members? Do we have? Who you got? LaHood, Representative LaHood.
So thank you for the explanation. If they're not going to be using different vendors to satisfy different insurance carriers, which vendor will they be using? Which vendor is permitted in this bill?
So right now there are multiple vendors that you can use. And I will say, I just want to mention that under current HHS waivers, they are allowed to use more vendors than you typically would be able to. HIPAA usually is who dictates sort of which vendors are allowed to be used. And it's all about what type of encryption these different services have. So right now it's pretty wide open. You can use just about anything, but during normal times, and we don't expect the HIPAA waivers to remain, obviously. They're there for important reasons. This was just sort of put in place so that people could get started very quickly and they could get this care to patients very quickly, whereas in normal times they would have to purchase. It's usually a purchase of some sort of software to be able to use that has sufficient encryption to maintain HIPAA standards.
Thank you.
But this would just prohibit, like if United Healthcare, and I'm just pulling United out of because I just thought of United's name. They decided that they wanted to have their own special vendor. This would, they couldn't keep a doctor from using, one that they've already paid for, they've gotten used to. It's the one they use with everybody. I mean, because if not, you could have a doctor having to, know the passwords and everything to 6 or 7 or 8, different vendors, which could be a real deterrent on whether you want to do telemedicine or not. So if you've become accustomed to the vendor that you use, you set up, you're comfortable with it, then that you can use it
And
at this point.
Typically speaking, I don't know if you've done a virtual visit during COVID, the patient doesn't really notice one way or the other. The functionality on the other side might be minor differences between it, but for most patients, it's just going to be a click to connect. The difference is going to be on the person providing the services side, whether that integrates into their EHR or has some other functionality on their end that they're really comfortable using.
Okay. Further questions? Any other questions from committee members? Okay.
Thank you.
We have Jesse Weatherington. Like to speak on the bill?
Yes, thank you, Madam Chair. Good afternoon, members of the committee. My name is Jesse Wethington. I'm here today as the President and CEO of the Georgia Association of Health Plans, which is the trade group representing Georgia's commercial health benefits industry and the individual and small group market. Just want to extend my appreciation to the chair. Our industry brought several concerns to her about the original draft 307. Those have been alleviated in the changes in the substitute. We definitely appreciate you working with us as well as the Medical Association. Had some discussions this week and most of those have been ironed out. Absolutely, we think this is a positive change in a large number of respects, codifying some of the flexibility that we've gotten through the pandemic. Really, we've seen telemedicine adoption probably go in 10 months where it would have been in 10 years. And it makes sense to make some of that permanent. So we appreciate you bringing this bill forward and we appreciate you working with us to address our specific issues.
Are there questions for Mr. Wethington? Well, I will say, Jesse, since I can say that since Jesse was my intern many, many, many years ago, that this incidence of working with the insurers was the most pleasant I have ever had working with the insurers. And I appreciate your willingness to work with us and to compromise and to help us perfect this bill. So thank you very much for that.
Thank you,
And
Madam Chair. We
for
appreciate you.
letting me have a different experience with the insurance people than I have often had in the past in trying to get patient accommodations like for step therapy and all. So I appreciate that.
You're
Thank
welcome.
you.
Cats and dogs living together.
That's yeah, I guess you could say that. You're right. Tim Clement on Zoom. Mr. Clement, can we get you up on Zoom?
Hi, I'm here. Can you hear me okay?
Yes, we would tell everybody your title and who you're with and all.
Yeah, I'm Tim Clement, Director of Legislative Development with the American Psychiatric Association. And I've worked very closely with Bethany Medical Association of Georgia, and appreciate the great work with the industry. I agree. And looking at the process, it was very seamless and a very good negotiating process. I don't think there's anything really additional I have to add other than to say that our members have found that through the pandemic, the provision to allow audio only has been life-saving in many instances for patients who their technology is just not working. They can't get through the telehealth connection. And if they don't get that care at that moment, they might, their care might spiral out of control and they could end up in an instance where they're hospitalized, there's suicide, there's an overdose. And also for some of our patients where audio only is really the only feasible way to get that patient to participate in care. So we really do appreciate your efforts to allow this greater flexibility, as we all recognize is important at a time of increased mental health concerns and substance use disorder concerns and rising overdose and suicide. So we really do appreciate and thank you for your work on this.
Well, thank you for your help on it. I will say that there were, in the initial bill, we did take things out like, if you've heard of mHealth, which I had never heard of, but there are all sorts of apps coming up where, people can just get the app and talk to somebody across the country. We felt like that we wanted Georgia patients to interface with Georgia physicians and therapists and all a little closer to home and establishing those relationships, and where we can set standards like, if you do talk with somebody or they do order something for you, there should be a way that you could reach them if the medicine doesn't work or there's a crisis at night, so that you're not trying to call a number clear across the state and getting an answering machine and not reaching the physician. So we have tried to make this specific to our state. I'm sure as telehealth and telemedicine changes over the coming years, we may need to refocus and revisit this, but for right now, this is how we got started. So if there's no further questions or people that want to speak on the bill, I will entertain and what the will of the committee is. Okay, I have a motion that we do pass the Health and Human Services substitute to House Bill 307. Do I hear a second?
Second.
Okay, several seconds. Thank you. Any further discussion? Anybody came up with any other kind of question that they might have about it? Huh? Oh, and it's LC 33863-2S, if anybody's checking. And seeing no hands or anybody on the web. We'll take a vote. Everybody in favor of the passage of the substitute to House Bill 307, say aye.
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 Thank you. Anyone opposed? No. Okay, sounds like the ayes have it, and I thank you very much, and I think the patients of Georgia will thank you in making sure that when the governor's emergency orders are lifted, that we still have provisions to have telehealth continue on a smooth basis in our state. So thank you, and thank you to everybody that worked on the bill. Okay, we pause. Let's go back to Dr. Kirkpatrick's bill.
Okay.
Now the
Sorry,
problem.
Madam Chair.
Okay, explain to us what the problem.
Okay, so lines 95 through 99 were added because there are different people who can give anesthesia of any kind. Anesthesiologists, CRNAs, or anesthesia physician assistants. And anesthesia physician assistants have to be supervised by a physician pursuant to a job description that is by the medical board. So we're not talking about independent practice here, but this section was added just to recognize there potentially could be a physician assistant administering conscious sedation as well as a CRNA. It's that simple.
Okay, and Scott, I don't understand what all the question was about. I understand, thank you.
I think the angst, and if I could just speak to that, is that the last minute nature of adding that, and certainly not everyone has seen the language, I think was the problem. But
Okay.
I'm very comfortable that this requires supervision and therefore is not really a problem.
Okay, Scott?
Yes, ma'am, Madam Chair. Yeah, so it was just as we do when we have bills that run through and you have last minute amendments. I just, we're neutral on the amendment right now. I have to run it by our folks. We're not trying to get in the way of it, but it will be adding a new auxiliary that's not contemplated under the Dental Practice Act. Currently, it's only anesthesiologists and CRNAs. What I've been explained is that this is common protocol to have a physician assistant assisting an anesthesiologist. So I just have to explain that to our folks, but I just wanted to, of course, be able to tell my folks that I am aware of this amendment and we can talk about it. And I trust that Dr. Kirkpatrick, she's been very good to work with, and the parties involved, the other stakeholders involved, that I just have to explain it to them. But I apologize for trying to lag this process up, but I just need to be able to tell my folks what happened.
It's okay. We're just, this is a very different session, things coming out of legislative council, and it's not their fault. Betsy's the most wonderful person in the whole wide world. We have just inundated them with last minute changes and huge bills and backup, and I don't see how they do. They work weekends and nights and yet trying to, as the days are chipping away, trying to get bills. So it's,
Yes,
I certainly understand. It's good to question, and that's why I sent y'all out to do it.
Thank you.
Can Jeremy, Betts, if you'll come back up before y'all all go. Okay. Okay. A CRNA is a certified
Registered nurse.
nurse anesthetist. Probably one of the oldest things of an outside the nursing profession that you could do. Even back when I was school, you could go on to become I don't know what they would say a nurse anesthetist is what we would call them then. I'm not sure they had an association. And to give anesthesia. Okay. Then since that time, we have had a designation of physician's assistants developed for many years.
Yes, ma'am.
And 1974?
Yes, ma'am. It was developed at Emory University in the mid 70s due to a anesthesia shortage.
Okay. And they are physician's assistants, but trained?
Yes, ma'am. In Georgia, they're licensed as physician assistants in anesthesia, whereas in the rest of the nation, they're commonly known as anesthesiologist assistants. The federal government classifies them as anesthesiologist assistants within the Federal Code of Regulations.
Okay. And one of them that, if you've been here for a while, you will know very well is Senator Hofstetler. over in the Senate side who is
Uh,
a
CAA, a certified anesthesiologist assistant.
assistant
Yes,
and,
ma'am.
a PA.
Yes, ma'am.
Okay, so that's how we got to these definitions. And by adding it, you were just trying to make sure that if that's what the physician that's supervising chose instead of a certified nursing assistant, if they went the PA
Yes, ma'am.
route, that would be permissible in the bill.
Absolutely.
Okay. Thank you. They're doing it now, and I thank Dr. Kirkpatrick for allowing it to be added because we would have hated to leave out people that were already doing this. Representative Sharper.
Thank you. I have a question for Scott. Is Scott still here? Oh, there you
Yeah.
go. All right, in which, we got the physician stuff situated. But you had you mentioned one word before you left about the intubation. Are you
Yes, sir.
clear? Have y'all got that?
That was
ironed
my
out?
mistake earlier, and I thank you for actually calling me back because I realized I had forgotten to clarify that point. This portion of the bill actually only relates to the conscious sedation rule. So IV sedation, they would still be able to maintain an airway on their own. That's where it impacts the dental offices, but I believe on the medical side, it's more of the general anesthesia, deep sedation.
Okay, because that would have changed this whole bill. Y'all would have been held up a long time trying.
Yeah.
Trying to work that.
Okay, but thank you. I was
But
just making
general
sure it was clear.
anesthesia is performed typically outside of a hospital setting in an oral surgeon's office. But
Right,
this,
okay,
this
Okay.
doesn't impact it as far as dentistry goes.
okay. Good.
Maybe it will help if I read you the very first line of the basic job description of a physician anesthesiologist assistant. The physician anesthesiologist assistant, PAA, may administer anesthesia under the direct supervision of an anesthesiologist. So this isn't changing anybody's scope and it's not leading to independent practice. That would have to be a different bill, and that was not the intention of this.
Mhm. Thank you.
Any other questions from members of the committee? We got it? Good thing. I will have to say I wouldn't have you wouldn't be seeing the bill today if I had great questions about it. But Senator Kirkpatrick and I represent basically the same area of East Cobb. And so the people that were her constituents were also on the edge of being my constituents. I think one of the people lived in my district. And it's just horrendous what the unsuspecting public and just pursuing, what they think is cosmetic and sort of spa-like treatments don't realize what could happen to them with the kind of treatments and the anesthesia that was given. Wouldn't they pay the ultimate price of death? And so having this tightened up, and as Tony said, after 20 years of working on it, is really a step forward. And I thank you, Senator Kirkpatrick, for bringing it. So do I have a motion now? Representative Sharper says do pass, and a second. Is there any further discussion? Seeing any, everyone in favor of the passage of the substitute to LC 338638S to Senate Bill 5, say aye.
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 Anyone opposed? No. All right, the ayes have it. And that takes care of all our bills for today. I want to thank everybody for coming, and those of you that spoke. Thank you very much. Thanks to the committee. We'll see you next week, and get ready. It may be a long meeting, or we may have to have two, because we have bills coming and moving toward being heard in the committee. So thank you very much.
Thank you.